Why is the doctor doing so many ultrasounds during every visit? Like, why is the doctor doing it? Or I've had patients ask me, why are you doing scans every visit? Like, do I need that many scans? So I've had both kind of patients. So which one are you? Do you want ultrasound every visit, or do you don't want ultrasound every visit? So most doctors will cater accordingly. Now, what I want to tell you is, as you saw in my previous videos, you need only 3 ultrasounds. So the detailed ultrasounds, the NT scan and the anatomy scan. These 2 are mainly done by the radiologist, and the growth scan might be done by a gynecologist. It's not that the gynecologist cannot do a detailed scan every time. It's just not possible, because the insurance sometimes is not providing the payment for that. Second of all, it's not required, so the doctor won't lean into doing an ultrasound every time. So when they're doing ultrasounds every time, they're just probably looking at the fetal viability, literally just checking if the baby's heart is present or no. So in first trimester, we cannot hear it with the Doppler. So sometimes they will do an ultrasound to see if the fetal heart is present or no. And in second and third trimester, they just want to show it to the patient, but they don't want to do it. Sometimes they do it because insurance will pay and all that, but it's too much of a headache to charge a patient for something which is unnecessary. So sometimes they just do it complimentary. Now, if you are someone who wants to see the baby every time, understand you can do that by just listening to the heart of the baby. So if you come to me in my government setup, we don't have an ultrasound. So we will use the Doppler every time, because we are not privileged to have an ultrasound machines in every room, because they don't want us to do an ultrasound. It's not required, it's not recommended. So when that is the case, I've had patients who will come and say to me, but doctor, what kind of hospital is this? Why are you not doing ultrasounds? And in that case, if the patient is so hell-bent and she wants to see the baby, I will take her to an ultrasound room and I'll just show her the baby. See, I'm not doing a detailed scan, but this is your baby. And same goes in urgent care. Sometimes we don't think patient needs an ultrasound, but she just wants to see the baby for whatever she's thinking. So I want to ask you, what is it that you're thinking, which is why you're asking your doctor to do an ultrasound? Because not necessary that your doctor is going to be a coach like me and who would understand what you really want. So how can you, first of all, ask yourself, why do you want to see the baby? And if you are clear why you want to see the baby, be very clear and tell your doctor, this is the reason why I want, instead of going here, because doctors are humans too. They will sometimes lash back and be like, you don't need this, you don't need that. But you just need to tell them, listen, I need this because of this. And in private practice, most doctors would always do what you want. They will try their level best to satisfy you, even when it's not required. In government, they might not. They might be like, you don't need it, these are the rules, we are not going to do something which is not required. But still, we will do something. Like, I would always try to help out my patients. So I would do the scan if she wants to, but I will tell her that this is not a detailed scan. Now, there are some patients who don't want to do so many scans. And that's fine too, because she knows there are only 3 scans required. And if you are one of them who doesn't want to be scanned every time, or a transvaginal scan or something like that, you can just say no and explore what is coming up. If you think that you should say no, but I don't know how to say no. So when your doctor is saying, okay, let's do an ultrasound, you're a high risk, I want to see the baby, you should see a baby, and she puts in a probe, you are scared that, okay, I don't want a transvaginal because what if I get a bleeding, or what if it troubles this and that? Can you say no to your doctor? And if you cannot, why you cannot? Because that's something which will empower you more, and I want you to be more empowered throughout your pregnancy. Doctors, nurses, all of them, they get scared of women who are empowered, but it's not about them. It's about you. You are the one who's holding the baby. You are the one who gets to decide. So, because that baby is going to be with you and your brain. So if you are thinking that, no, the doctor did not do what I wanted her to do, ask the doctor what you want. Be very clear, get what you want. All right? Don't just say yes to everything that your doctor offers.